Hi guys, this is a short, sharp video on reflection. How to do it, what not to do, how to make it less tedious, how to make it less of a bore. Look, we all reflect all the time, but the worst thing to do sometimes is to put it on paper. How do I get it out from here onto paper? So that's what we're going to talk about. I'm going to give you 3 quick tips to make reflection a little bit less strenuous and a little bit less difficult to do. I'm a GP and a medical educator. Thank you to a few people who've asked for reflection videos, Sean, Paul, Sarah, Raj, to name a few. It's one thing that we hate doing, but this video is going to hopefully help a little bit and make it a little bit less difficult. So what is reflection? Reflection is something that, like I said, we do all the time. It's about your gut feeling to something. It's about your core feelings about an event, whether it's a learning event or some reading that you've done or a patient that you saw. It's about what did you go out taking away from that episode and how is that making you or adding to your development as a doctor in training or GP training or whichever stage of training that you are. So it's about that gut core feeling that we have all the time and how do you translate it, like I said, from here onto paper. Now, I used to hate the word reflection. I used to fill me with dread. When I went home, I thought, oh, I've got to do 3 or 4 reflections today. I need to catch up on my reflexive entries, and it used to get quite a drag. But once I saw a patient with it's quite a non-specific patient, a young guy, came with some tummy pain, looked pretty well, examined him, everything okay, numbers were fine. I was about to send this guy home as a normal, gastroenteritis, whatever it might be. And then something made me stop and think, okay, what about appendix? I don't know why I thought appendix. I don't know why it came to my mind. It wasn't going to my mind when I was talking to the patient, that's for sure. But something made me think about appendicitis. And I ended up calling the RSO and speaking about it and getting the guy. I don't know how I got it through the RSO, but I got it through the RSO. The guy went in, had his investigations or whatever, and was operated on the next day. And he had a flaring appendix going up. So I was reading the letter the next day and I went to my trainer, I started talking about this and saying, look, I really didn't think about this, but this is what's happened. And he was like, oh, that's really good. You reflected really well on that. I was like, okay, so what did I do? What I did was think about it a little bit and I suddenly reflected on it. And that's the essence. When I realized the essence of reflection is not picking a patient and then writing a whole load about it and thinking I reflected really well. It's about letting the patient come to you. So the first tip I say about reflection is let the patient or the event come to you. Don't go looking for an event or a patient to reflect about because you're starting with the wrong idea. So what I suggest is on the way home, maybe after a clinic, think about the patients that you saw and figure out which is the one that sticks in your mind most. It might not be the one that you think is the one that should stick in your mind most. Maybe you've seen an acute chest pain that you sent to hospital. Maybe that would be a good reflective case to do. But actually, you think about maybe the young child who came in with a really simple ERT. For some reason, that sticks in your mind. So figure out which one is sticking in your mind most and then think about why. Why is that patient sticking in my mind? I could have just forgot about this patient. I would never have thought about it again. It would have been just one of the other 150,000 children that I see with ERTs. But why is that one stuck out? If you start to think about that, you might find the reflection gets a little bit easier. So number 1, don't find the patient to reflect on by thinking about it. Let the best reflective patient come to you. Think about a situation, a clinic, a day, and some patient will stick out for some reason. Second thing to do, now that you've got your patient that for some reason is in your mind, think about 3 words that you are thinking about when it comes to that patient. 3 emotions maybe: guilt, frustration, feeling out of depth, unsure about what you're doing, happy, proud, whatever those things are. Think of 3 words that really sum up that particular patient or learning event or bit of reading or whatever it is that you did. Start with those 3 words. They're the basis of your reflection. Now, if you work your reflective entry around those 3 words, you find that writing it becomes so much easier than when you start from the normal process of what happened, what did it make you think. Start with the bottom line. Start with 3 emotions and you'll find that it gets a bit easier to write. And thirdly, once you've got these 3 key buzz emotions or words in your mind, start from the bottom upwards. What we normally do with the reflective entry is we start from the top as normal and type things through our boxes as we go down. So what happens? You end up with a really top-heavy write-up. Because all our energy goes into the top box. What happened, describing everything in detail, their heart rate was this, their blood pressure was this, their tummy examination was this, in their history they said they had this, they took this drug, I did this, I suggested this medication, I did a referral. So we're just reading and rewriting things that people can go and read in your notes. Yeah, if you start with like that, then all your bulk of your thinking and your mental work goes in the top part. So by the time you get down to the bottom boxes, you're fed up with this case now. You just want to end it, save it, and move on to the next one because you've got 3 more to do today. Try and start with, so what you don't want to end up is this kind of pattern. you want to end up with this kind of pattern, because the bottom of the questions, the what did you get out of this? What were your learning outputs? All those things are your real, true reflective entry bits. So start with the bottom up, start with the bottom questions, and think of those, in that bottom question where it starts, you might say, what did you learn out of this? Or what are your learning needs? Or how did it make you feel? Put those 3 words in that you've thought about already. Start there. You'll start to find you bulk around it, you write most things in that, and you start to go up the ladder, and your entries get shorter and shorter and shorter. So by the time you get to the top, actually you've written most of the bulk here, so you don't need to rewrite the whole description. You put a really simple line: 35-year-old patient came in, ERT symptoms, sent to hospital. That is your description. All the bulk and the hard work is done here based around those 3 words that you thought about. And before you know it, you'll find that your reflective entries, you're going to get so much good feedback on it, because you're suddenly delving into what's in your mind as opposed to rewriting what people can read in some entry that you put on a computer. So think about these 3 things when you go forward into reflection. Let the reflection come to you. Don't think about what patient will be good to reflect on. It never works well that way. Secondly, start with 3 gut reactions. What was your gut reaction to them? Think of 3 words, focus your reflection around those 3 words. And number 3, start with the bottom and go up. Don't start with the top and go down, because you'll find that all the bulk of the work happens in the bottom few boxes, and that's where you put your energy in, and that's where you find that actually what's coming out from your mind is reflecting on paper as opposed to your description, and you're taking up all your energies there. So I hope that helps, hope it makes sense. If you have any other further queries that you have about reflection or any other parts of GP training or exams, and you want a video making on it, just let me know. My details should be down below. Subscribe to the channel if you find it useful. We've got our AKT CSA support group on Facebook. Please do join that if you think that might be of value to you. Hopefully we'll get to catch up at some point soon. Take care.